What if I told you there's one simple movement so powerful that, as a surgeon, I personally tell my own parents to do it every single day to protect their legs, their balance, and their independence? I'm not talking about a gym workout, expensive equipment, or anything extreme. I'm talking about one basic exercise that most people ignore, yet I see the consequences of skipping it in the operating room all the time. Weak legs lead to falls, pain, and loss of freedom, and it happens far earlier than most people realize. Stay with me, because in the next few minutes, I'm going to show you the exact exercise, trust from my family, and why doing it daily could change how you move for the rest of your life. Strong legs are the foundation of long-term health, independence, and longevity. Yet this is something most people don't fully appreciate until it starts to disappear. When your legs are strong, everyday life feels effortless. You stand up without thinking, you walk without fear, you climb stairs without hesitation, and you move through the world with confidence. But when leg strength begins to decline, those same simple actions slowly turn into challenges, and that loss of ease quietly affects every part of life. What many people assume is just aging is often the direct result of weakening legs, not the passage of time itself. The truth is, aging doesn't automatically make you weak. Inactivity does. The body adapts to what you ask of it, and when the legs aren't challenged, the muscles shrink, the joints stiffen, and balance deteriorates. This process can happen gradually, so slowly that people barely notice it happening until one day they realize they can no longer get up from a chair without using their hands or feel unsteady walking on uneven ground. That moment is not random, and it's not inevitable. It's the result of years of declining leg strength that went unaddressed. Strong legs play a vital role far beyond movement. They are essential for circulation, acting as powerful pumps that help move blood back to the heart. When leg muscles weaken, circulation slows, leading to swelling, fatigue, and a greater strain on the cardiovascular system. Over time, this can contribute to reduced endurance and overall energy levels, making people feel older and more limited than they truly are. Maintaining leg strength supports the entire body's ability to function efficiently. Independence is another critical piece of the puzzle. The ability to live independently is closely tied to leg strength. Tasks like standing, walking, carrying groceries, and getting in and out of a car all rely on strong, stable legs. When those abilities fade, people begin to rely more on others, which can impact mental health, confidence, and quality of life. Strong legs allow people to stay self-sufficient longer, preserving dignity and freedom as the years go by. Longevity itself is deeply connected to leg strength. Research consistently shows that people with greater lower body strength tend to live longer and experience fewer serious health events. This isn't a coincidence. Strong legs reduce the risk of falls, which are one of the leading causes of injury and loss of independence in older adults. A single fall can trigger a cascade of complications, from fractures to reduced mobility, that can dramatically shorten lifespan. Preventing that fall by maintaining leg strength can change the entire trajectory of aging. Perhaps the most empowering truth is that leg strength is one of the most controllable aspects of health at any age. Even small, consistent efforts to keep the leg strong can slow down or even reverse decline. The body responds remarkably well to regular use no matter when you start. By prioritizing leg strength, you are not just exercising muscles, you are investing in mobility, confidence, independence, and a longer, healthier life. As a surgeon, I don't just study health in textbooks or talk about it in theory. I see the real consequences of neglecting the body every single day. I see patients after the damage has already been done, when pain, weakness, or injury has reached a point where surgery feels like the only option left. That perspective changes the way you think about prevention. It makes you realize how powerful simple daily habits can be, and how many problems could be avoided if people focused on the basics earlier. That's exactly why I don't give casual advice when it comes to my parents' health. I give them the same recommendations I would want for myself, based on years of seeing what truly makes a difference. When I tell my parents to do one specific exercise every day, it's not because it's trendy or complicated. It's because I know what happens when people stop moving well. I've seen strong, Capable individuals lose their independence after a single fall, often caused by weak legs or poor balance. I've seen knees and hips deteriorate faster than they should because the muscles meant to support them were neglected. These are not rare cases. They are incredibly common, and they usually start with something very simple, a gradual loss of strength that goes unnoticed for years. The exercise I recommend daily addresses the biggest risks I see in clinical practice. It helps prevent falls by improving balance and stability. It protects the joints by strengthening the muscles around them, reducing unnecessary stress on cartilage and ligaments. It improves circulation, which supports healing, reduces swelling, and keeps the legs feeling energized rather than heavy or stiff. From a medical standpoint, it checks multiple boxes at once, which is why it's so valuable, especially for aging adults. What makes this advice personal is that I'm not speaking from a distance. These are the people who raised me, who I want to see walking confidently, traveling, enjoying life, and staying independent for as long as possible. I don't want them to end up in an operating room if it can be avoided. I don't want them recovering from preventable injuries or surgeries that could have been delayed with the right habits. That emotional connection reinforces how serious I am about this recommendation. I also know that consistency matters more than intensity, especially as we get older. That's why I don't tell my parents to push to exhaustion or follow extreme workout plans. I tell them to focus on one reliable movement they can do safely every day. Daily repetition keeps the body prepared for real-life demands like standing up, walking, or catching themselves if they stumble. These are the movements that determine whether someone stays active or slowly becomes limited. Ultimately, the advice I give my parents reflects what I wish more people understood earlier in life. You don't need advanced equipment or complex routines to protect your health. You need simple, intentional movement done consistently. When a surgeon tells his own parents to do the same exercise every day, it's because he has seen what happens when people don't, and he knows how powerful prevention can be when it's done right. The bodyweight squat stands out as one of the most effective movements for leg health because it mirrors how the human body is designed to move in everyday life. Every time you sit down on a chair, stand up from the couch, or lower yourself to pick something up, you are performing a version of a squat. This makes it a highly functional exercise, meaning it directly strengthens the movement you rely on daily rather than isolating a single muscle in an artificial way. By practicing this motion regularly, you reinforce a pattern that keeps you capable, confident, and stable in real-world situations. What makes the squat so powerful is that it engages multiple muscle groups at the same time. The quadriceps in the front of the thighs, the hamstrings in the back, the glutes, and even the calves all work together during a squat. At the same time, the muscles around the hips and core activate to stabilize the body. This coordinated effort builds balance strength, which is essential for protecting the joints. When muscles work together as they are meant to, the knees and hips experience less stress, not more, which is why properly performed squats can actually reduce joint discomfort over time. Another reason bodyweight squats are so effective is their adaptability. They can be adjusted to suit almost any fitness level or age. Someone just starting out can use a chair for support, limiting depth and range of motion, while someone more advanced can go deeper or slow the movement down for greater control. This flexibility makes squats accessible and sustainable, which is critical for long-term leg health. An exercise only works if people are willing and able to do it consistently. Squats also play a key role in maintaining mobility and balance. As you lower and raise your body, your nervous system learns how to control your center of gravity. This improves coordination and awareness of body position, which directly translates to better balance. Improved balance means a lower risk of falls, and fewer falls mean fewer injuries that can dramatically impact quality of life. This is especially important as people age, when reaction time and stability naturally begin to decline without regular practice. Beyond strength and balance, squats help keep joints healthy by promoting movement through a natural range of motion. This movement helps circulate synovial fluid within the joints, which acts as lubrication and nourishment for cartilage. Regular squatting can reduce stiffness and maintain flexibility, making daily activities feel smoother and less restricted. When joints are used regularly and correctly, they tend to stay healthier for longer. Perhaps most importantly, the bodyweight squat builds confidence in movement. When people feel strong and stable standing up and sitting down, they are more likely to stay active. That activity creates a positive cycle where movement builds strength, strength builds confidence, and confidence encourages even more movement. This cycle is a powerful tool for preserving leg health and independence over time. The simplicity of the squat, combined with its wide-reaching benefits, is what makes it such an essential exercise for maintaining strong, functional legs throughout life. Many people believe that squats are bad for the knees, especially if they already experience discomfort or stiffness. But this belief usually comes from misunderstanding how the knees are meant to work. The knee joint depends heavily on the surrounding muscles for support and stability. When those muscles are weak, the knee absorbs more stress during everyday movements like walking, climbing stairs, or standing up. Properly performed squats strengthen the muscles that protect the knee, allowing the joint to move more efficiently and with less strain over time. Pain does not always mean damage. In many cases, knee discomfort is a sign that the muscles around the joint are not doing their job effectively. When the quadriceps, hamstrings, and glutes are underdeveloped, the knee is forced to handle forces it was never meant to manage alone. Gentle, controlled squats help rebuild that muscular support system. As strength improves, the joint becomes more stable, and many people notice that their knee pain gradually decreases rather than worsens. The key to making squats safe lies in how they are performed. Rushing through the movement, dropping too low too quickly, or allowing the knees to collapse inward can create unnecessary stress. In contrast, slow and controlled squats encourage proper alignment and muscle engagement. Keeping the chest upright, pushing the hips back, and distributing weight through the heels allows the larger muscles of the legs to take on the workload, protecting the knees from excessive pressure. For beginners or those with existing joint concerns, modifications make squat accessible and safe. Using a chair as a guide allows individuals to control depth and maintain balance. Sitting down and standing back up is a natural movement pattern that most people perform multiple times a day. Turning that motion into a deliberate exercise helps the body relearn how to move efficiently without pain. Over time, as strength and confidence increase, reliance on support can be reduced. Squats also benefit the hips, which play a crucial role in knee health. Weak hips often cause poor movement patterns that transfer stress to the knees. By strengthening the muscles around the hips, squats improve overall alignment of the lower body. This reduces uneven loading on the knee joint and contributes to smoother, more comfortable movement during daily activities. Another overlooked benefit of squats is how they improve body awareness. Moving slowly through the squat allows individuals to feel how their joints and muscles are working together. This awareness helps prevent compensations that can lead to discomfort or injury. When people understand and trust their movement, they are less likely to avoid activity out of fear, which is often what accelerates joint decline. When done correctly and progressively, squats are not an enemy of the knees, but one of their greatest allies. They restore strength, improve stability, and rebuild confidence in movement. Instead of avoiding squats due to fear of pain, learning to perform them safely can become a powerful step toward healthier knees, stronger legs, and greater freedom. In everyday life, one of the biggest mistakes people make when it comes to exercise is believing that more intensity automatically leads to better results. In reality, especially for long-term leg health, consistency matters far more than how hard you push in a single session. The body responds best to regular, repeated signals that reinforce strength and movement patterns over time. Doing a small number of controlled squats every day sends a clear message to the muscles, joints, and nervous system that they are needed and should stay strong. Daily practice keeps the legs engaged and prevents the long gaps that allow weakness and stiffness to set in. When days or weeks pass without using the muscles properly, the body begins to adapt to that inactivity. Strength fades, joints feel tighter, and movements start to feel more difficult. In contrast, even a few minutes of squats each day keeps the system active. The joints stay lubricated, the muscles remain responsive, and balance stays sharp. This steady approach is far more sustainable than occasional bursts of intense effort followed by long periods of rest. Another advantage of prioritizing consistency is that it reduces the risk of injury. Intense, infrequent workouts can overwhelm muscles and joints that are not accustomed to the load, leading to soreness or strain. Gentle daily squats allow the body to adapt gradually. Each repetition reinforces proper movement without pushing beyond safe limits. Over time, this builds durable strength that supports everyday activities rather than exhausting the body. Consistency also builds confidence, which is often overlooked but incredibly important. When people know they can move their body every day without pain or fear, they become more willing to stay active. That confidence carries over into daily life, making tasks like climbing stairs, standing up, or walking on uneven surfaces feel less intimidating. Confidence encourages movement, and movement reinforces strength, creating a positive cycle that supports long-term health. Daily squats also fit easily into real life. They do not require special equipment, long workout sessions, or perfect conditions. They can be done at home, in a small space, and in just a few minutes. This simplicity removes many of the common barriers that prevent people from exercising regularly. When something is easy to start and easy to maintain, it becomes part of a routine rather than a task that requires motivation every time. Over weeks and months, these small daily efforts compound into significant improvements. Muscles become stronger, balance improves, and movements feel smoother and more controlled. People often underestimate how powerful this gradual progress can be because the changes are subtle at first. But over time, those subtle changes add up to greater independence, reduced pain, and a higher quality of life. By choosing consistency over intensity, you give your body exactly what it needs to stay strong and functional for years to come. A few controlled squats each day may seem simple, but that simplicity is what makes it effective, sustainable, and capable of preserving strength, confidence, and independence well into the future.